Well, thank you for joining me in this session today. Today, we are going to do a psychosocial assessment where I will be asking you a pretty strict list of questions all about your personal history and what's going on with you currently. It's a really structured interview style where we won't break away and go too into depth about any of the concepts we're going to talk about today, but it's going to give me information to go forward with in our future sessions. The only person who will be able to um, also obtain this interview information will be my supervisor.
Okay.
Okay, cool. So, Shay, tell me a little bit about yourself and what the current state of your mental health is right now.
Oh, jeez. Um, well, a lot of times I'm kind of stressed and, just with like basic stuff. Um, Work sometimes can be a little bit overwhelming and navigating family stuff sometimes is a little bit hard. Definitely have some weird history there. Um, and I sometimes struggle to really cope with that and manage a lot of the stress and anxiety, and then it ends up kind of snowballing sometimes, and it'll uh, trigger like a depressive episode where I'm just really down on myself and really struggle to do some of the you know basic stuff that people do to take care of themselves.
So, it sounds like some of your major stressors that you're currently experiencing involve what should be, as you described, basic stuff, um, navigating family, your work life, and daily activities of living that bring stress, anxiety, and ultimately end up with depressive episodes.
Yeah. Yeah.
Okay.
I mean, otherwise, I like to think of myself as a mostly, um, well, I'd like to be a mostly happy person. Like I have interests and hobbies and stuff like that, and friends that I see every once in a while. I mean, as you get older, it gets a little bit different, and people get busy and they have lives and stuff like that. But,
Okay.
I make efforts to reach out to people and stuff like that. But my family, closer family, lives in another state, and that can be hard. So I don't have a lot of a support system that's close. Um, and so I just kind of like to uh, have some regular balance in my life where, I'm just doing those normal everyday things and I'm not feeling unsettled or uh, like anxiously waiting for the other shoe to drop, you know, that sort of thing, or have the big sense of impending doom.
Mm-hmm. How often do you feel that big sense of impending doom?
Um, that's probably a couple of days a week.
A couple of days a week. Okay. What would you hope to achieve from therapy sessions going forward?
Um, Probably just getting some better coping skills and maybe sort of find out um, what is it that makes me anxious. I mean, like, you think about the regular things like, getting stuff done, task lists, stuff like that, but like, um, sometimes talking to somebody else, a professional, can really help you identify uh, what things, maybe like in your childhood that you didn't think about, like really affect you as an adult and stuff like that. and how I can sort of reroute my thinking so I can prevent the more depressive episodes where things get really hard. I feel like if I can manage my anxiety better, that I can sort of prevent that from happening, and just be better about my self care and stuff like that.
Okay, those are excellent goals. I think that's a lot of information that we can work with, and a lot of information that we contribute towards that we can contribute towards a treatment plan going forward as well.
Okay, cool.
Thank you for sharing all of that.
Mm-hmm.
So this next portion of the assessment is where it gets a little bit more rigid. I'm going to go through several pages of interview questions asking you all about different parts of your life, and it's not necessarily in a specific order or anything like that, but as I go through, I'll just be jotting notes of different aspects of your life, like I said, so that we can use that information to work together in future sessions. Okay.
Okay.
All right. So the first section of this is about alcohol and substance use history. What substances have you used, and when was the age of first use?
Well, I was never somebody who's really big on like substance use. I had friends. It was around a lot when I was younger. Like, I had friends that would like pop pills or smoke weed or whatever. I was a little bit more straight edge or goody two shoes. But definitely, I think it was a couple years before really was supposed to be drinking. Definitely partook in some alcoholic beverages.
Okay. So drinking alcohol.
Mm-hmm.
When was the first time that you drank alcohol?
It was something that my parents were pretty casual about, honestly. So must have been a teenager, probably around 15, 16, something like that.
Okay. Mid-teens then. Mid to late teenage years.
Mm-hmm.
What would you say is the age of your heaviest use of alcohol?
Probably around 19.
19. Any recent use of alcohol?
I mean, I might have a drink a couple of times a week, but never outside of like what your doctor recommends or anything like that. I take some meds where it's not recommended, so I try to stay safe there. I'm not trying to go to the ER or anything.
Okay. What kind of alcohol do you usually drink?
Usually like wine or beer. Every once in a while, like a mixed drink or something.
Okay. Do you know the date that you last drank?
I think it was last weekend.
Any other substances? Marijuana, over-the-counter
Mm.
prescriptions, cocaine?
No, goodness, no. That's a little bit. I always felt like stuff like that would make my anxiety worse. Like alcohol kind of loosens you up, makes you feel a little bit relaxed. But I've never really been into anything that was gonna like send me to jail big time or wherever. I think I was always too anxious to do something like that. Risky behaviors make me nervous.
Okay. So my next question is, have you ever injected drugs?
No. Oh.
I didn't think so.
I've known people that have done stuff like that,
Sure.
but
Yeah.
not my jam.
Okay. In regards to consequences due to alcohol, I'm gonna go down a list of different side effects of alcohol intoxication, and I just want you to tell me yes or no if you've ever experienced it, okay?
Yeah.
Hangovers,
Oh yeah.
over drinking, overdosing.
Well, I've definitely gotten sick before. I guess that qualifies as that, like over drinking.
Ever go to the hospital or anything for drinking too much? Get your
Nah.
stomach pumped? Okay,
No,
okay.
no.
Sleeping problems?
I don't think so. Usually when I drink too much, I pass out pretty easy. That's usually when I sleep better. It's kind of sober sleeping that's usually the problem.
Okay. Lost job,
Nah,
incarceration,
nah.
shakiness,
I mean, maybe from being dehydrated or whatever, like,
increased tolerance,
oh, sure.
seizure,
Nah,
DUI,
no.
homicide,
No, gosh.
blackouts,
Oh, sure.
gastrointestinal bleeding,
I don't think so. Gosh, I hope not.
relationship problems,
Oh, yeah.
assault.
No.
Any other issues with alcohol that you've had?
Um, I don't think so outside of like, uh, like I said, like friends or family or like being in relationships and they're doing it and they're into it and whatever. And then when you try to kind of like pull back and be responsible, like it causing some issues, they feel like they're being judged or something or whatever, that. And sometimes that influence being there makes it kind of hard to just like stay steady.
Gotcha. What would you say is your longest period of sobriety?
Uh, like not drinking at all or,
Yeah.
oh, I don't know if I've ever really had that.
Okay. Are there any triggers that influence you to drink?
I mean, I guess like if I've had like a stressful or hard day or something like that, like I plan stuff out and it doesn't go the way that I want it to, or like have an argument with your partner or something like that, that can be really frustrating. And so, like, a little bit anxious or a little bit stressed, whatever. And sometimes just having a drink is nice.
Have you been tested for HIV?
No.
Do you gamble?
I mean, I've been to the casino before. It's not like it's my favorite or anything, but I've gambled a couple of times.
Okay. On occasion, then.
Yeah.
Okay. I'm going to ask just some questions about issues related to gambling and just
Mm-hmm.
see if there's anything that we should go over there, okay?
Yeah, for
All right.
sure.
Have you ever gambled longer than you planned?
I mean, yeah, I've stayed at the casino, longer than I planned on or whatever.
Have you ever lost sleep thinking about gambling?
No, I don't think so.
Have you ever borrowed money to gamble?
Oh yeah, everybody's done that. Borrow $5-10 from a friend or something like that.
Have you ever been remorseful after gambling?
Yeah, when you lose money a little bit for sure. That's always sucks.
Have you ever gambled until your last dollar was gone?
Nah, I try to set a solid fun budget, or like I said, like I'll borrow $5 or $10 from somebody, but I'm not trying to not be able to pay my bills.
Have you ever used income or savings to gamble while letting bills go unpaid?
No, no.
Have you ever made repeated unsuccessful attempts to stop gambling?
I don't think so. I've never really thought I had a problem or anything.
Have you ever broken the law or considered breaking the law to finance gambling?
No. No, I don't think so.
Have you ever gambled to get money to meet financial obligations?
I mean, everybody puts some quarters in the slot hoping they'll win big. You can pay off your student loans or something like that. But I've never really thought it was gonna pan out. That's just always the secret hope that's there.
Okay. In regards though, like, have you ever gambled to like pay an electricity bill or pay a car payment,
Oh no,
a mortgage or anything like that?
nah.
Okay. Um, so this next section is about risk taking and impulsive behaviors. Currently or in the past, have you engaged in shoplifting,
No,
drug dealing,
no,
reckless driving?
no. I don't think I'm a reckless driver. I mean, everybody's gotten a couple tickets before, but I try to make sure like I have somebody that's driving if we're going out or something like that.
Carrying or using a weapon?
No,
Unprotected sex?
I think everybody's done that a time or two.
Okay. In regards, so this would be like casual hookups and unprotected sex.
Yeah, when I was a teenager.
When you were a teenager? Okay. Gang involvement?
No.
Any other risk-taking behaviors that you might participate in that you can think of that you can tell me about?
Um, Not that I can really think of. I mean, I think those examples cover everything, right?
Mostly. It's a general encompass of different risk-taking behaviors, but I feel there's a lot more out there than what's just on this list. So that's I like to ask about the other because then um, you might be able to tell me something else from your life that would involve that risk-taking behavior. So if you can't think of anything, that's okay though. We can move forward.
Okay.
Okay. Um, this next section is about risk assessment. How much of a risk would you say you pose to yourself on a regular basis?
I don't I don't understand the question like a physical like a mental like you like would I hurt myself or something like that or
Yeah.
uh I mean I don't think I do or anything. I'm not like, suicidal or anything like that. Like I get depressed, like just kind of down in the dumps and stuff, but
Okay.
I'm not trying to hurt myself.
Okay. What about a risk to the safety of others?
No, I don't think so. I've never wanted to like hurt anybody or anything, Everybody
Okay.
gets mad from time to time, but I'm not violent or anything.
Is there a serious current risk of any of the following? Abuse or family violence?
No.
Suicide?
No.
Any psychosis or severe psychological symptoms that you've experienced?
No, I don't think so.
Do you own a handgun at home?
No.
Any other weapons? That would
Um,
be good. Okay.
I mean, everybody's got some kitchen knives,
Sure.
but
Yeah.
that's about it. Not really a weapons person.
Okay. So let's talk about your current and history of psychiatric care. Um, are there any medications or treatments that you're undergoing currently for psychiatric care?
Yeah, my doctor's got me on some anti-anxiety medication.
Okay. Do you know the name of the medicine?
I think it's called Lexapro.
Who's your clinician?
Dr. Newton.
Have you had any side effects with the Lexapro?
Sometimes it can make me like really drowsy and stuff.
Okay.
Every once in a while it gives me some headaches. But yeah, I just try to make sure I get some extra sleep from time to time, and it's usually pretty okay.
Okay. Do you feel you're experiencing any barriers to access of medications or treatments for your anxiety?
No, I don't think so.
Any other current medications or treatments for psychiatric treatments?
No.
Okay. Anything prior to current? Exploring your entire history. Is there anything else as far as medications and treatment for psychiatric care?
No, I don't think so. I mean, every kid gets vitamins and stuff like that from their doctor, but
Okay. Um, what's your living situation like right now?
I live with my boyfriend and our
Okay.
cat.
Okay. Are you aware of any history within your family of psychiatric treatment?
Yeah, my sister uh, had some, I guess you'd call it mental illness or some kind of breakdown or something when she was a teenager, and she was an inpatient for a while at a youth hospital.
Okay. Anybody else in your family that you know of?
Um, I think one of my grandparents, um, but I didn't really know them that well. I think it's just something that my mom had mentioned in passing about her mom having some issues. I think it was like postpartum depression or something like that.
So this next section that we're going to go over is a trauma assessment.
Okay.
Do you feel you have a history of neglect or exploitation? This would include emotional, nutritional, medical, or educational neglect.
Um, I mean, I guess when I was a teenager, my parents kind of left me to myself a bit. I remember being, like I'd go hang out with friends and stuff like that, but they weren't really checking up or anything like that, just kind of left to myself. They're cool now that I'm older or whatever, but it's not like we were ever super close or anything.
Was a social worker ever involved or anything like that?
Oh no, just normal sort
Any
of.
kind of like nutritional or medical effects due to being left alone by your parents?
Oh no, I don't think so. I mean, like when I was a teenager and stuff like that.
Were you able to go to school and
Yeah,
um,
yeah, that was totally fine.
okay. Do you feel that you've ever been abused in any time in the past or present by family, significant others, or anyone else?
Well, everybody's had a couple bad relationships before. Um, definitely dated one guy that like yelled at me a lot and stuff like that. He was kind of an asshole. Oh, sorry.
So you would consider it like an abusive relationship?
Yeah, I would think so.
Okay. So exploring this abusive relationship that you had, how old was the person who you were in a relationship with at the time?
That was like early college. I think I was 20 and he was like 22 or something like that.
And you said that you experienced some verbal abuse. Would that include like verbal put downs?
Yeah.
Okay. And this is no longer occurring?
No, no, I definitely ditched that guy.
Did you ever feel that you were being threatened by the person?
I mean, there are like lots of ultimatums and stuff like that, which were really frustrating. But I mean, I don't feel like he was never like physically violent or anything like that. If that's what that question's about.
Well, it could be. It could encompass physical violence and physical intimidation, But it can also refer to verbal intimidation as well, such as when a person uses their words to make another person feel threatened.
Maybe.
Okay. Did you ever feel that you were made to feel afraid?
No.
Um, was there any incidents of pushing, shoving, slapping, kicking, strangling, hitting?
No.
Any forced coercion or forcivity or coercion into sexual activity?
No.
Is there anything else that you'd like to add to that experience that you had and tell me about?
No, maybe it's something we can touch on later.
Okay.
You know.
Yeah, we can definitely do that. Was there ever any kind of reports of abuse during this relationship, such as like to a social worker, police officer, a judge, anything like that?
Yeah, one time the neighbors kind of called the cops, tried to claim like domestic disturbance, whatever. We were arguing or whatever. We'd both been drinking and stuff, and he was getting kind of loud or whatever, and I was telling him to be quiet, and then he just got louder and he was being obnoxious, and they called the cops on us or whatever, and he toned it down after that one.
So was he arrested or what was the outcome of that situation?
Nah, they we explained everything and we were just arguing and stuff like that, and they took some statements and stuff, but outside of like making sure we weren't disturbing the peace or something like that, it wasn't too big of a deal.
Are there any other histories of trauma, such as physical injury, combat, car accident, natural disaster, etc.?
Yeah, I was in a car accident once, and that was pretty scary. Hit some black ice. My car swung around, and it was honestly probably a miracle I didn't end up smashed by another car on the highway or something like that. My car was totaled and everything like that. Had a little bit of a rough time driving on the highway for a while. After that, it was pretty scary.
Okay. That's definitely something that we can explore in future sessions. Sometimes when we have incidences of trauma, um, we might not feel that they're such a big deal when they happen, and we might even look back on them as not being a big deal, but there might be more to uncover at times, and we can explore that if you'd like to.
Okay, yeah, for sure.
As far as your social history, have you ever been diagnosed with a developmental delay or disability?
Mm-mm.
Any religious or spiritual orientation?
No, not really. I mean, like that's cool and all. Like, I'm respectful and stuff, but I don't really have any strong personal beliefs or anything.
How would you describe your ethnic and racial identity?
Uh, I mean, I guess mixed race.
What's your current socioeconomic status like?
Or like my job and stuff like that.
Yeah.
I think I do pretty all right. Got a solid office job. I'm a salaried employee, and I've got benefits and stuff like that. So I mean, I'm pretty secure in that area.
Okay.
I guess you'd say like lower middle class or whatever would be the term.
How would you define your sexual orientation?
Uh, I guess I would be bisexual.
Any indigenous heritage?
No.
What is your national origin?
American?
How would you define your gender?
Yeah, I'm a lady who was born one.
Is there any other social information that you'd like to share with me, such as political affiliation or groups that you're a part of that define your social life?
No, I don't think so. Like I said, I'm pretty respectful, but I'm not someone who feels super strongly about a lot of that kind of stuff. I really honestly avoid politics as much as possible. Like, I'm sort of you pay your taxes, I don't really care what you do.
Okay. Tell me about some of the coping skills that you use regularly.
Well, like when I'm feeling stressed or whatever, I'll usually call a friend and chat with them about my day, but uh like I said, people get busy and stuff like that, so I don't always have somebody to call, and that can be kind of frustrating. I mean, honestly, most days I go home and I'll watch some TV or something and grab a beer or whatever. Um, I try to get some physical activity and stuff like that, but sometimes it just feels like a lot of effort to go to the gym and stuff like that. Um, I like music though. I'll listen to records sometimes, and I feel like sometimes that's kind of like a relaxing sort of thing that I do for myself. That's pretty nice.
What's your favorite genre of music?
Ooh, that's a hard one. I really like a lot of different stuff, but maybe jazz.
Okay,
Jazz is a good one.
cool.
I'll listen to that when I'm frustrated or something, and I usually feel a lot better after.
Okay. Music is a powerful outlet, that's for sure. I encourage it for everyone, not even just my clients. So, um, now kind of on that same note, we talked about coping skills, and I think you kind of listed some of these as well. But how would you define your hobbies?
Oh, I guess my hobbies are a little bit more artsy kind of stuff. I like sketching, um, and I mean, I guess I like listening to music and shopping for different music, and so I like physical forms of media. So I like to collect records and stuff like that. That's a pretty good time. Um, uh, Oh, I like reading, but it's just more like casual stuff. It's nothing, like super cool or anything. Just like fantasy novels and stuff like that. Sometimes that's kind of nice to just escape into something else for a little while. Um, I mean, can you consider your pet your hobby?
Yeah, absolutely, I would.
I'd probably take too many pictures of my cat.
Okay. Yeah, something many of us are subjected to. How would you describe your education?
I have a bachelor's degree.
Okay. Where'd you go to school?
Western.
Michigan, right?
Yeah.
Okay.
Yeah.
What did you study?
I studied behavior science.
And are you working in that field now?
Yeah.
Okay. What's your current job title?
I'm a clinical supervisor.
In regards to your living situation, would you say that you're able to take care of yourself?
Oh, yeah, no, for sure.
How would you describe your housing situation currently?
I rent an apartment.
Okay. Do you ever feel that your housing situation would be described as dangerous?
Nah, I feel like I live up in a pretty alright part of town. Stuff like that. It's not really like noisy or anything. I don't really hear like sirens going off all the time. I mean, I definitely did like where we lived when I was a kid. I was, we'd hear gunshots and stuff.
Okay.
But no, I tried to make sure I live in a pretty solid area these days.
So would you describe your current living situation as adequate?
Oh yeah, for sure. I like it.
Good. You said that you are currently employed.
Yeah.
What company are you employed by?
Sorry, mind blank. Encompass.
Cool. How long have you worked there for?
Oh, it hasn't been long for this company. I worked at a different one when I was at Western for a while. This one's only been about 6 months or so.
Okay. How do you feel about your job?
It's all right. I'm still getting to know the company and stuff like that. So, but I mean, the field is cool. I like it.
Would you say you lean more towards satisfied or dissatisfied?
Probably satisfied. Yeah.
And you said your last employer, you worked for Western Michigan University?
Yeah. They had well, company there that I worked for about 4 years.
Okay. What was your reason for leaving?
I just moved.
Do you require any adaptive devices for daily living? This would include glasses, hearing aids, crutches, wheelchair, braille, translators.
Oh yeah, I mean I have glasses, but I don't wear them all that often.
Okay. Any history of falling down?
No.
Do you have any past or current legal problems that you're dealing with?
No, I don't think so. Certainly hope not. That would suck to find out.
Any court-ordered treatment for therapy or other medical services?
No, this is voluntary.
Okay. In regards to what you came here for and what you're seeking out through treatment, would you say that you have a good grasp of the problem that bothers you the most and that you can accept it?
Not really. I guess that's kind of why I'm here. I kind of want to find out, like I feel anxious and stuff like that, like not getting the things done that I need to, or I'm, like not motivated enough to really like take care of myself the right way, but kind of like why I can't get it into gear. It's just not super clear.
So, looking for more information about your problem with anxiety and where you can go forward to treat it and work with it.
I'm not understanding the question. What do you mean? Like,
in regards to accepting that you have anxiety.
Oh, I mean, yeah, like I have it. Like,
Mm-hmm.
I don't.
I was just restating what you had said, like kind of like what you had said in regards to not being able to accept that you have anxiety.
I mean, I know I have anxiety. I'm just not sure why have it all the time? Like, you know.
Mhm. Would you say that you recognize the need for treatment?
Yep, that's why I'm here.
Do you ever feel compelled to minimize your problems or blame others for them?
Um, I mean, well, I don't really feel like it's a super big problem or anything. Like that's a but I mean it's big enough that it bugs me, but I don't think it really affects like a lot of other people or anything like that.
Okay. As far as your motivation for coming to therapy, would you say that it is an external or outward motivation from others? Or would you say that the motivation is internal and coming from yourself?
I think it's a little bit of both, you
Okay.
know. Like people that know me and stuff sort of mentioned that I just seem a little bit too on edge sometimes, and uh, especially during the work week or whatever. And I definitely don't want to feel that way, but a couple of friends of mine mentioned that maybe I should go see somebody about it.
How would you describe your appetite?
Normal?
No issues with eating or anything like that?
Nah.
Okay. Have you recently gained or lost a significant weight?
No.
Do you ever feel the need to binge eat or overeat in excess?
Um, I mean, no, I don't think so. I mean, I think everybody, sometimes is hungrier than other times or whatever. Um, Definitely had some midnight meals I regretted later, but
Sure.
I don't think like, not a binge or anything.
I think that's normal. Do you ever feel the need to restrict food?
No.
What about purging, vomiting,
Oh,
laxatives,
God, no. Uh-uh.
over exercising to avoid weight gain?
Nah. Like I said, I struggle to get to the gym sometimes, so
What about hiding or hoarding food?
no.
Any food allergies?
No, not that I know
Religious dietary restrictions?
of. Mm-mm.
What about medical dietary requirements?
No, I don't think so.
Okay. How many hours a night would you say that you go to sleep?
Uh, Probably about 6 or 7.
So, any over the counter medications or prescription medications for sleeping?
Sometimes I'll take like melatonin or something like that.
Would you say that you have a consistent bedtime?
Not really.
Would you say that you have a consistent wake time?
Yeah, I mean, I gotta wake up at the same time every day.
Do you have time for relaxation before bed?
Yeah, I mean, when I make time for it.
Are you able to reduce distractions before bed?
Uh, what do you mean, like sirens or something, or like,
As in, are you able to limit um, distractions such as um, loud noises, kids, technology?
oh, I sleep with the TV on, so I guess I don't really do that.
Okay. Anything else about your sleep behaviors and hygiene that you could tell me about?
I don't think so. I never really thought about it much.
Do you ever have trouble getting to sleep?
Oh yeah, for sure. Brain racing at night and stuff like that.
Do you have trouble staying asleep?
think so. Getting to sleep is the hard part. Once I'm asleep, that's usually pretty fine.
Do you ever have trouble waking up?
Uh, I mean, every once in a while, yeah, but not really consistently or anything.
Do you ever experience excessive daytime sleepiness?
I think everybody gets those mid-afternoon sleepies, but I'll just have a cup of coffee or something like that, and it's fine.
Okay. Nothing excessive though.
No, I don't think so.
Do you take naps?
Not really.
Do you ever experience irritability or mood shifts?
Well, I think every woman does at least once a month.
Okay. Anything out of a normal context, though, that you would say in your own personal life?
No.
Do you ever have issues with concentration?
From time to time, yeah.
Okay. How often would you say that you have those issues with concentration?
I mean, periodically when I'm like really stressed about different stuff. I don't know, maybe a couple times a month or something.
Okay. So not something that you experience on a daily basis, or something that throws off um, your natural way of living.
No.
Okay. Do you ever experience work or school function impairment?
No, I don't think so. I think my work performance is all right.
In regards to barriers to your quality of sleep, do you ever feel that temperature affects your quality of sleep, such as being too hot or too cold regularly?
Oh yeah, for sure.
Okay. Um, how would you describe your environment while sleeping, temperature wise?
I like it to be pretty moderate. Um, I've got to have like air conditioning in the summer or whatever. I usually like to sleep with the fan on too because I like the noise in the background and like TV. In order to, I don't know, the background noise. I just feel like helps me fall asleep and stuff like that.
Okay.
I have a hard time if it's not there. Um, you know, uh, Outside of that, it's sort of.
Would you say that your um, quality of sleep is excessively hot or cold?
Uh, I might be cold at night sometimes. Whatever. I do sleep with a lot of blankets. I guess when I think about it.
Do you feel comfortable when you sleep?
Yeah, I think so. I think my bed's pretty comfortable.
When you're working, do you work a night shift or swing shift?
No, no, it's strictly daytime.
Are there any loud noises that you have to deal with while you're sleeping?
No, not really. I mean, sometimes you hear the garbage truck early in the morning or something, but not like late night loud noises or anything. Like I said, my neighborhood's pretty quiet.
Any issues with excessive light?
I don't think so. Like I said, I sleep with the TV on, so sometimes the light's there, but that usually doesn't bother me.
Do you ever feel pain when you sleep?
No.
Nightmares?
I think everybody has nightmares from time to time, myself included.
Would you say that they are a barrier to your sleep quality?
Nah.
Okay. So no like recurrent nightmares that are disrupting your sleep cycle on a regular basis?
No, not really.
Okay. Well, this reaches the end of our assessment. I appreciate you hanging in there with me. I know that these types of interviews can feel very clinical, and it can almost feel like
A job interview or something
yeah,
like that,
yeah, absolutely. But what this does is it gives me a lot of information to get to know you and see where we can work together and work toward a solution to some of your mental health problems and promote mental wellness going forward. Um, but thank you for sharing all of that with me. Um, is there anything else that you would like to add to what we've discussed today?
No, I think we've kind of covered a lot of stuff. I mean,
Mm-hmm.
I'm sure as we chat, and get more comfortable, there'll be other things that'll come up and we'll talk about and whatever. But I think that pretty much covers it.
Okay. Well, thanks again for coming here today and sharing all of this information. Going forward in our next sessions, I think that we're going to work we're going to be talking about some of the issues with stress, daily uh, living situations that cause you anxiety, and some of the other issues that you've brought up that are affecting your mental health. And we'll have a much more open dialogue where we can delve into those things going forward. Okay.
Okay, sounds good.
Okay.